Carla Macias, host of Best Docs Network featuring Forest Park Medical Center right here in Austin, Texas. Our show features some of the best doctors in your area, as well as one of the top medical facilities in Texas that will soon be opening their doors in spring of 2015. Now let's start off today's show by introducing one of these Forest Park physicians, Austin urologist Dr. Lauren Jones. Dr. Jones will be discussing non-cancerous enlarged prostate.
Care about their patients and their alleviation of their symptoms.
It's a very exciting day, obviously, this partnership, because obviously Forest Park Medical Center believes in excellence. We pride ourselves on world-class service, and what better world-class organization is there than the Dallas Cowboys?
The cultures are so aligned. It's two groups, people, two teams that are really focused on excellence, have a passion for excellence. And it takes the same sort of things to make it work, because it's a team effort in the hospitals as well as on the field. You need the coaches, you need the players, the trainers, you need all the equipment staff here, and in the hospital, the nurses and the physicians, the technicians, all the people who maintain facilities all have to work together.
And really, if you think about what we do in healthcare, surgeries and the complexity of putting together a team, we honestly play the Super Bowl every single day, every patient. Our surgeons are quarterbacks, and they've got a team of great associates. Everybody's got to be the best and brightest at what they do, and together they can finish a game and score a big win for a patient. It's very much like football.
Our goal for Forest Park, Fort Worth, is really focused on excellence and innovation, and that's what the Cowboys are about. They have a strong tradition of really excelling at what they do, and that's what Forest Park does. We think that is going to be really significant to the community and to their surrounding communities, and we think that not only will Cowboys fans love the Cowboys this year, they're going to love Forest Park.
And if you look at the Cowboys, it's excellence year after year. It's an awesome partnership. The excellence of the Cowboys and the outstanding patient care and customer service at Forest Park Medical Center, you couldn't ask for a better team.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Carly has a question for Dr. Hahn. I get enough sleep at night, but I am tired all the time. Should I be worried?
Fatigue is actually a very common complaint, even if you're young and healthy. I think the cause of fatigue are different in women and men, particularly because women may have menstruation issues that causes them to be anemic. But the other reason why a person may be tired could be because they have a thyroid disorder, for example, hypothyroidism. So if a person seems to be much more fatigued than they should be, even with the sleep and the exercise level that they do, they can consult a physician to ask what is going on. Is it caused by anemia? Is it caused by thyroid or something else? The physician may not find that those are the problems, but that can be discussed with the physician as far as what the causes of fatigue is.
Austin is very fortunate to have Forest Park come to this area. Forest Park is unique in that it's owned and operated by the physicians. So we're very fortunate to have a group of almost 100 physicians from the Austin area. I think they average about 15 years experience in Austin, every one of these physicians. So they know Austin, they know the people of Austin, and they know what Austin needs when it comes to healthcare. I think patients benefit greatly from a physician-owned hospital for many aspects. One is that who knows better than your physician what you need when you're in the hospital. And again, many physicians don't have that control or that voice in a typical hospital setting. But in this setting, they do have control, they do have a voice, and they will do what's best for their patients. I think it's the difference between owning a car and renting a car. When you're an owner, it's your place, and you want to make it special. You want to make it the best place for your patients to get care. And so I think that's really what makes it different. Our goal is to be the very best hospital in the community. Obviously, physicians know best what's good for their patients, and they wouldn't be so interested in this hospital and creating this hospital if there were a good alternative for them currently. So they're very excited. I'm very excited about working with them. It's going to be a very collaborative approach. I think there's a lot of uncertainty, obviously, in the healthcare industry right now and going forward. No one really knows what's going to happen. But to be successful, there has to be close collaboration between the physicians and the hospital. And what closer model can you have than having the physicians own the hospital and really control the hospital? So I think it's a successful model for the future and one that will greatly benefit this community. My example is the hotel industry. You could tell there's a difference between a 5-star hotel and a 2-star hotel. The people are happy to be there. People have just loved getting care there. You go to a 5-star hotel once and you want to go back to that hotel. That's the environment we want to create. You combine that with state-of-the-art equipment, state-of-the-art care, and that's going to be Forest Park Medical Center.
Some of the physicians over at Forest Park Medical Center make it a priority to get involved in their communities, whether it's here locally or around the world. Up next, we're going to take a look at how some of Austin urologists participated in this year's Zero Prostate Cancer Run.
This is the second year that Forest Park has been out here at the Zero Prostate Run. And it means a lot to us to be here, being a new facility that's opening up in the Austin area. And our sponsorship with a lot of the doctors in the area, especially with urology. The importance of this event in spreading the awareness of prostate cancer and the need for screenings for men is extremely important. And being able to be a sponsor here and be able to help spread the word is extremely important to us.
We have a certified 5K run, a 1-mile fun walk, and then new this year we have a 200-yard superhero dash for dads for kids under 12. Every kid that runs in the superhero dash for dad gets a Zero superhero cape. So the goal is to get kids to talk to their parents about prostate cancer and about cancer in general. When somebody in your family is diagnosed with cancer, it can be very scary for a kid. So we want them to feel like this is something that parents or their grandparents or their uncles or people in their family with prostate cancer, that they can win this battle against prostate cancer. And this is what they can do to help support their family member by coming out and running in a race like this.
I'm out here today in support of the men who have the diagnosis of prostate cancer. I'm here for myself because I have the diagnosis of prostate cancer. The turnout today was greater than I expected. I think we have more than 500 people here. I was particularly impressed with some of the shirts that I saw, not just the Zero Prostate Cancer Run Walk shirt, but people that had the shirts that say Walking for Dad and with Dad's name, or Granddad and with Granddad's name. That kind of hit home.
We're really excited about the opportunity to participate with the Zero race because it's an opportunity to allow everybody to know more about prostate cancer, how prevalent it is and how important it is to really look into, make sure that you won't have problems with that down the road. The turnout's been great. It's actually our largest turnout in the 4 years we've been doing this. It's given us the opportunity to raise a tremendous amount of money.
It's really good to see other survivors because we all have our story. And then also to see other survivors' families and kind of connect.
Oh, it means a lot to me. It means a lot to my patients and their families and our families to get together in support of this cause. Even my kids today, they told me what we were doing today, and I didn't have to tell them. They knew why we were running today. And so it's a great cause. They had the dash for the kids today with these capes that they've never done before, and it was just a great sight. I'm excited for Forest Park to be a part of this as well. We're blessed with great weather. I mean, it couldn't be more perfect out here, and a lot of great sponsors and music and food, and it's just perfect. I mean, it draws more and more people every year, and that's our goal, is just to raise awareness.
I hope that everybody who has prostate cancer can feel better.
Eating eggs for breakfast not only tastes good, but they help to slim you down too. Each egg you eat has 6 grams of protein, but only 72 calories.
Did you know that Forest Park Medical Center Dallas has the AccuVein Vein Finder? This allows the phlebotomist to actually see the vein before drawing your blood, eliminating multiple sticks.
Dr. Michael Putney is an orthopedic surgeon who specializes in arthroscopic and reconstructive surgery of the knee, shoulder, and total joint replacement, as well as sports medicine. Now let's hear what Dr. Putney has to say about his methods on practicing medicine.
My methods are always, first the patient comes first. I treat my patients like I or my family would want to be treated, and I always prefer to be conservative and try conservative methods before going straight to surgery. I emphasize to all my staff that every patient that comes in, they need to think of that as their mother or brother or sister coming in to get taken care of by us. I've lived in Texas all my life, so I treat people like a Texan.
I think Forest Park in Austin is going to be a great thing. It's a great, excellent medical facility. The doctors involved with it are going to be great. It's going to be a very great opportunity for the patient to have another choice in something that is going to be geared to not only giving them excellent health care, but a great medical experience.
I'm excited about Forest Park. I think it's going to be a terrific asset to the Austin community, and that it's going to be a new hospital of a new type. It's going to be doctor managed and driven, and will be focused on taking care of patients and focused on the best outcomes and the best patient care.
Medicine is about the doctor and the patient. We want to have perfectly open communication with patients, and I think that's what Forest Park is all about. It's giving the patient a really excellent experience and excellent health care all at the same time.
I'm really excited about joining the Forest Park family. I think that medical care should be between doctors and their patients. I'm really excited about being involved with a hospital that's run by doctors.
A lot of times physicians have ideas about what could be done differently to make it a better experience for the patient or a less costly experience for the hospital. But oftentimes we're not able to make those changes, and so I wanted to be able to make those changes, since this would be a physician-controlled hospital.
I've had the pleasure of actually doing some surgeries in the Dallas Forest Park. It's a beautiful facility and it's extremely well run. Again, I'm a surgeon, so what happens in the OR is important to me, and the ORs were very well staffed, very well stocked, and ran like a clock. It's perfect.
The other thing about Forest Park is that based on it being physician controlled and based on its size, that it's better able to adapt and evolve as things change, because in medicine things are always changing, and if you don't adapt and evolve quickly, then what you're doing tends to not be the standard of care anymore. And so that's another reason I was so interested in Forest Park.
I'm excited about Forest Park. It's my honor to be associated with them. I have been here in Round Rock for a long time, and we have missed a hospital like this. I think the whole concept of Forest Park is centered around improved patient care and actually saving them money by reducing the administrative costs that exist at other hospitals. This is a good thing for Austin, and it's a good thing for the doctors, and it's a good thing for medical care.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
By heading over to bestdocsnetwork.com, clicking on Austin under the Our Doctors tab, there you can watch hundreds of other videos on some of today's current health topics and procedures. Now, one of those doctors you can find on our website is Austin plastic surgeon Dr. Jeffrey Cohn. Now let's listen as Dr. Cohn discusses correcting ear deformities with ear wells.
Charlotte was born through a C-section, and when I first saw her, I thought maybe her ear was folded over just because that was how she was in the womb, but it became pretty clear after the next couple of days that it wasn't going away. It was just floppy, the cartilage wasn't formed properly, and so we decided to try and fix it.
As a practice that specializes in pediatric reconstruction, one of the most common deformities that we see are deformities of the ears. The standard of care for these historically has been surgery. You wait until the child's in kindergarten or first grade when it becomes a social issue, and then there's a type of surgery called otoplasty that we perform. In 2010, the FDA released an ear molding device, which has radically changed the way that we manage ear deformities.
I just know kids can be really mean, and I certainly didn't want her to not be very self-conscious about it until she started going to school and then have people make fun of her and have kids say mean things about her. We chose the ear wells over plastic surgery because we thought it would be a safer option for all of us, and we just didn't feel very good about her getting surgery when she was even 4 or 5. I remember Dr. Cohn being so friendly and being so kind and explaining to us exactly what was going to happen, exactly what was going to go on. He said Charlotte was a perfect candidate for it.
It has an external cradle which sticks directly onto and around the ear, and then we have customizable pieces that help hold the ear to a normal shape and position. So you keep the earwell device on for 4 to 6 weeks so that the ear has had enough time to learn a normal shape.
I was really, really happy with the results and the fact that it was virtually painless. I am extremely grateful that we did it when we did, because the cartilage wouldn't have formed if we would have waited. Time was of the essence and we needed to do it as early as possible. So I'm very grateful that we were given information for Dr. Cohn so that we could jump on it real fast.
This is Operation Once in a Lifetime's annual Toys for Troops drive. What we do is we raise toys for military families that need a little assistance during the holidays. These military families can range from active duty Army, Navy, Air Force, Marines to veterans. And not every military family is in need this holiday season, but for those that are, we're trying to help them just all over the U.S., when we can.
This is our second year to be with Toys for Troops. Several of our staff members have family members in the military. And of course, we have several veterans on staff. On the holidays, we like to serve our staff food. We get the directors involved in that to serve the staff. And it's provided complimentary for the staff, for anybody in the community that wants to come in, and for today for the soldiers that were coming in with us today. It was a great honor to be able to serve them. I think the great thing today showed was the community involvement and the sponsorship and the involvement with the Cowboys. The Cowboys came today, the cheerleaders were here, the mayor from Frisco came in today, some of the community came in, our staff were present, they brought their families in. So again, it goes to great community, great families, and great leadership, I think, throughout the community of Frisco.
Most of these toys collected today are going to be going down to Fort Hood, which is one of the largest military installations in the world. We have hundreds of military families on waiting lists needing help. Forest Park Medical Center has been a big support for not just Operation Once in a Lifetime in the military, but the Frisco community in general, their Kids Surgical Center, and not just here in Frisco, but even their Fort Worth location helping us out. And we honestly would not have been able to help as many families if it wasn't for them helping us this year.
I think one of the things we consistently strive to be is involved and touchable and visible. So I think today was one of those events where the staff are very visible, they're very involved in what we do. Leadership is not behind walls, we're very accessible to our team. And I think with our turkey trot earlier, everybody volunteers, gets involved, they enjoy working at somewhere that can give back and has the ability to give back, and it draws the community into it to make it a true community hospital.
If you or anyone that you know are looking into options for breast reconstruction, then this next segment is for you. Up next, Dr. Ned Snyder will be discussing the DIEP flap breast reconstruction procedure.
I went in for a regular mammogram, just a yearly thing, and I had a DCIS in my right breast, diagnosed the day after Christmas. Some mutual friends said, oh, we have a doctor who's, supposed to be the best in his field. And I was like, yeah, I'll just give him a call. And this gentleman, this Dr. Snyder, took so much time with me, spent the day after Christmas on the phone with me, walking me through all the different options and what my diagnosis really meant, and, not to freak out. And this was really doable, and I felt so confident after I spoke to him. Dr. Snyder really won me over with the fact that he was so willing to give his personal family time to me when I was in a state of crisis. But I will say, when I started researching all the local doctors and really seeing what my options were, that's when I realized what a rock star Dr. Snyder is. Just from every angle, people praising him.
So Kate had breast cancer and elected to have bilateral mastectomies. She had reconstruction then with bilateral DIEP flaps, or DIEP flaps, which are flaps where we use tissue from your abdomen, skin and fat from the abdomen. We take a portion of the blood supply out of the muscle that sits below that skin and fat. We disconnect it from the abdomen and then reconnect those blood vessels in the chest. So we're making a breast out of what a breast is skin and fat, and it's 100% her own tissue.
I had my surgery February 19th, and April 28th I went back to work part-time. You get that sort of diagnosis, you really rethink all the things in your life that are important, all the things that are meaningful. I recommend Dr. Snyder in the fact that all of my research came back to him, and I feel very blessed that I was able to stay here in Austin and have this done here.
When we use your own tissue, it's something that's going to age with you like normal tissue, like normal breast, and won't require maintenance per se over the course of your lifetime. Once you're reconstructed, it's yours, and it's yours to keep.
It feels great to 4 or 5 months later say, I'm done. I feel great, I'm active, I'm back with my family. It's exactly where I want to be.
Hi, I'm Dr. Troy Deal here with Forest Park Medical Center to discuss high ankle sprains. So what exactly is a high ankle sprain? A high ankle sprain is an injury that involves the twisting of the ankle during a contact sport or a non-contact sport that can result in a very significant injury, and one even requiring extensive treatment and recovery. So the best way that we are able to determine the difference between what you consider, or what we commonly call an ankle sprain versus a high ankle sprain, is really the mechanism of injury. How did the athlete or the patient actually injure it? And so it's the history in itself of how the injury occurred. In addition, it's also looking at whether symptoms that may be associated with their injury or other signs, whether it be swelling, bruising, the inability to control the ankle, or just pain associated with a certain part of the ankle, all help guide us on exactly what is injured during this type of injury. Now we talk about the treatment of a high ankle sprain, and the important part about it is recognizing that when somebody does present with an ankle sprain, that we do see that they have an associated high ankle sprain. It sounds like they'd all be the same, but actually the high ankle sprain is a more significant injury and requires a longer treatment plan, and a lot of times may require surgical intervention as part of its true treatment. So when we talk about what is the length of recovery for a high ankle sprain, it does again relate to the grade of injury and or other associated injuries involved in the ankle sprain. It can be a simple process in the sense that a few weeks, the patient, if it is a grade 1 or 2 injury, may be back playing sport. However, I usually tell patients that this is definitely a longer process, and in my mind, it's usually 6 weeks is minimum. It can be up to 3 months, depending if there is any surgical intervention plan for the treatment of the injury. I'm Dr. Troy Deal with Forest Park Medical Center. Thank you very much.
Mike has a question for Dr. Kevin Donor, who needs to worry about testicular cancer.
Testicular cancer is a cancer that we don't talk about a lot. Thankfully, it's rare. There's probably about 6,000 cases in the US per year, but it's important because it frequently occurs in young men. In addition, testicular cancer is highly curable and highly treatable even in advanced stages. Thankfully, some breakthroughs that were made several decades ago. Testicular cancer is typically treated with surgery to remove the lump, and then chemotherapy is highly effective. It's one of the true success stories in the oncology field, thankfully, where chemotherapy has cured what was once a fatal disease for a lot of young, productive, healthy men in the prime of their lives before, in past decades, to now a very curable disease.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Lodging provided by Radisson Hotel and Suites. Thank you everyone for joining us on another episode of Best Docs Network featuring Forest Park Medical Center right here in Austin. Now, if you're ready to request an appointment with any of the doctors you've seen on today,